This is a special two-part episode of Bright Spots in Healthcare entitled How Sutter Health is Scaling AI Across the Enterprise. I'm joined by Kiran Mysore, the Chief Data Analytics Officer at Sutter Health. And while most health systems are stuck in pilot mode, Sutter is operationalizing AI at enterprise scale with over 2,000 physicians using ambient technology and nearly 1 million clinical notes generated through it. In part one, we're going to go beyond the buzzwords. You'll hear how Sutter built AI governance that accelerates rather than slows down innovation, how they gained the trust of clinicians without overselling the tech, and how they chose not to chase ROI, but to earn it through doing the right thing for patients and providers. If you have not yet subscribed to the Bright Spots in Healthcare podcasts, stop what you're doing right now. Type in Bright Spots in Healthcare wherever you're listening right now and click subscribe. And that way you're going to get all these great episodes with all these great guests downloaded to you so you could take these bright spots and inspire new thinking at your organization. Now, let's dive into episode 1 of how Sutter Health is scaling AI across the enterprise. Enjoy. Greetings, everyone. This is Eric Glazer, and welcome back to Bright Spots in Healthcare. We're produced by Bright Spots Ventures. Each episode, we bring leaders together to not only inform you, but also unearth bright spots, successes at hospital systems, health plans, and other healthcare organizations across the land, because our goal is to identify as many of these bright spots as possible so that you can determine if the ideas shared during this episode can be applied at your organization. We believe that this strategy of finding a bright spot and cloning it is the most effective way to improve healthcare in our lifetime. Today, we are tackling a challenge I know many of you are facing as you listen right now: how to move from artificial intelligence experimentation to AI execution at scale. Health systems have no shortage of these pilots, but what's missing right now is the infrastructure, governance, and leadership to make AI sustainable and impactful. Our guest today is Kiran Mysore. He is the Chief Data and Analytics Officer at Sutter Health and one of the pioneers in our industry actually scaling clinical AI across a large integrated health system. So today we're going to try to cover everything from ambient intelligence and automation to ROI, clinician trust, and the evolving role of governance in unlocking AI's promise. If you care about operational efficiency, clinician engagement, or, quote, future-proofing, unquote, your care delivery model, I believe this planned conversation right now will offer a really good practical look at how one of the country's most prominent health systems is making AI work at scale. So, Kiran, welcome to Bright Spots in Healthcare.
Eric, thanks for having me. I'm really appreciate it.
Yeah, I appreciate you being here. I know we've done a little bit of prep. I'm going to jump in. I was listening to your your interview with CDO Magazine, and you spoke about the gap between AI's potential and what's actually being realized across healthcare. And you noted that the issues aren't tech necessarily, but it's more about the process, trust, and integration. So from where you sit at Sutter, what does it really take to move from isolated pilots to meaningful, scalable innovation?
Eric, this is a challenge that a lot of our healthcare systems are facing today. And at Sutter Health, we are no different. One of the key things I think about, and I'm going to state the obvious when you think about AI, is the relationship between a patient and a physician. This relationship dates back thousands of years, all the way to the era of Hippocrates. And it's built on, the principles of safety, empathy, trust, accountability, and so on. So AI, if we're going to use AI to really supplement this relationship and support this, we have to do it in a way that respects it and ideally strengthens it. And that becomes the sort of the foundation of how you think about pilots to scale. At Sutter Health, we've identified many different use cases as we evolve in the space of AI. But the real thing we think about in terms of scaling is, is it the right use case? Does it have the right level of support at the clinician level? Does it ultimately translate into patient value and experience of patient healthcare, patient in the healthcare. These are all elements we think about, and are we measuring it in the best way possible? So these are some of the key elements we think about early on, and of course, technology, data, security, all of those play into it. But the right scaling model is a combination of all of these factors.
Okay, so building on the principles of safety, empathy, quality, and I said patient value, paraphrasing what you just said, and using that as your foundational guidelines and principles, that's how you kind of match sort of that mission statement for a pilot. And then if it's scalable, and then you're checking the list. Are these elements being covered, and is it trackable?
Exactly. And Eric, and this has to be a structured process because AI pilots can, grow like weed, if you will. You have a lot of different scenarios where AI pilots can really grow. One of the things we've established at Sutter is a governance ecosystem and a governance council. The importance of this is that we look at every idea that comes our way and evaluate that is this really going to meaningfully make a difference in our patients' lives? So patient facing. Is it going to help our clinicians and our providers do better? And so this is again patient provider facing. And then does it ultimately assess the risk of a patient getting sick, and can we prevent some things from happening? And so there is an element of that we evaluate. And most of the time, the low-hanging fruit, like at the administrative aspects of AI, are things that we also look for: efficiency, in terms of scale. All of these come into play as well. So we go through our governance we go through a way to really check through these boxes and then say which one is the one that we work on. The last thing I'll say is it's easy to sort of get diluted by many different pilots. The important thing here is focus. So we'd like to go deep and do it really well, and do it at scale. And so that way the benefits can actually be realized at scale as well.
Okay, I love that. So some of the things in the governance that I captured, is this really enabling us to improve patients' lives? Is it enabling us to help our providers do their jobs better? Does it reduce the risk of patients getting sick? Does it improve the overall operations and efficiency of the business?
Absolutely.
Okay. I want to get into something you said recently about EHR. So I think in my notes, what I wrote after, again, the same article, that achieving broad EHR adoption was a big milestone, but it wasn't transformative. And I think that's an important distinction for everyone listening. Important, but not transformative. Can you expand on what you meant by that? And then what do you mean when you say that the EHR was never meant to be the endpoint?
Well, the EHR was a really important milestone in a digital transformation journey of healthcare. It was necessary because we wanted to take advantage of the computing and the digital the technology changes that were happening in the last couple of decades to help streamline processes in healthcare. So when you schedule an appointment as a patient, when you go see a doctor and talk to the doctor, and the physician actually captures your medical information, all of these, digitizing all of these were necessary so that the overall end-to-end process was smooth and you can get access to care in a more streamlined way. But when you really start to think about the complexity of healthcare processes themselves, the EHR tools don't necessarily solve for that. I mean, they help guide us through a certain way of doing it, but they don't necessarily sort of make it the most optimal. I think the promise of AI is really where we could sort of relook at all of these processes and say, is there a better way to do something? Is there a better way to engage with our patients? Is there a better way to provide care? Is there a different way to integrate some of these great predictions that are coming our way to the point of care where physicians can actually act and provide care? So to me, it's the endpoint is not just digitizing with EHR. The endpoint is really optimizing it, and AI has a great way to sort of play into that ecosystem.
So I like what you just said. It's almost as if the ER integration has set us up for the transformation that AI is going to allow us to explore.
Absolutely, 100%. It's the foundation on which we build upon in order to really enable AI. Now, one of the things is, AI can, with the advent of agentic architecture and so on, you have an ability to sort of go and look at all the processes and say, well, where are we not as optimal, and sort of standardize all those processes. And so that is an emerging area that I'm excited about and love to explore and see how we can apply it in healthcare. But today, a good EHR, good data foundation, good integrated data are really powerful enablers of AI.
So let's talk about what you're doing today. When we're talking about AI-driven clinical innovations that are delivering impact at Sutter today, can you share some of those, at least one of those with us? It could be efficiency, outcomes, workflow.
Yeah.
But let's get some bright spots.
I'm excited about the work we're doing in helping our physicians with their cognitive overload and burden and with their administrative tasks. So, in the industry, we sometimes call it ambient documentation, and many health companies have done this, healthcare companies have done this. So at Sutter, we have a fantastic digital team. It's led by Laura Welt, who's our Chief Digital Officer, and Dr. Veena Jones, who's our Chief Medical Information Officer. And together, they've sat down to solve a problem, which is how do we reduce the time spent on clinical tasks so clinical teams can focus on what matters most, which is the patients. So we started this in earnest about a year ago, very rapidly scaled this to the organization. At one point, just recently, we did the measure. More than 2,000 Sutter Health physicians are using this technology, and we've seen more than almost 1 million clinical notes released through the system, which means these are conversations between a physician and a patient, documented, clinical grade with all the right information in there so that we can actually embellish the EHR system as efficiently as possible. And that also provides great clarity to our patients who are very happy that the information that they're actually sharing with the physician is actually captured really well. Our physicians are happy because they are able to see time savings in charting and so on of up to 30%, which is amazing. So they can actually get back home to dinner on time. So this is one thing that we are really excited about. We recently published this in a prestigious journal called the JAMA Network Journal, and we highlighted the time savings, the improved well-being, and enhanced job satisfaction, which actually ultimately goes back to our mission, which Warner Thomas, who is our CEO, always says, patients first, people always. And ambient AI is helping us and our clinicians be more present with our patients so that they can really focus on the care.
Well, I love that. Patients first, people always. I didn't know that was your mission statement. So when you're talking, it was your chief digital officer and your chief medical informatics officer. Did I catch those two titles correct? That were, and forward to this ambient program, over 2,000 docs using it, approximately 1 million clinical notes so far, and it's improving patient satisfaction. It's improving, and it's reduced the administration burden on providers by 30% so far.
Yeah.
Is there another example you want to share, or I don't want to?
No, we can. So we can talk about many. One of the, I'll pivot a little bit to talk about efficiency and focus. So, one of the things in operations is always about, are we running our hospitals the best way possible? Are we seeing our patients on time? Are the processes of, nurse triaging or emergency room, discharge, are they efficient? So there are many, many metrics and many different data points that our operators use every day in service of our patients. So we are a very large health system where, over 24 hospitals, we serve 500,000 patients. We have hundreds of, primary care clinics, surgery centers, ambulatory facilities, home health as well. To get a sense of what is happening in the system in a single view is extremely hard. And one of the things we've done is really built a data foundation and a capability called the Sutter Navigator, which connects all of our operational metrics in one place. And so our operations leaders and our finance leaders actually have a single point of entry where they can actually go and see how's their hospital doing, how's my utilization rates, what is the access look like, the days to access look like, how are we doing with regard to contract labor? As you know, labor is really hard to get, and we need to make sure that they don't get burnt out along the way. So are we actively managing our labor effectively or not? How does our transfer center look like when our sickest patients come? Can we refer them quickly to the right specialty care? All of this is in one ecosystem. So we built that to really give a bird's eye view of the entire system to the operators. And follow up to that is really about where are these trends actually going? So are these are we seeing an increase in patient stay in a hospital, for example? But what are the reasons for that? Are we taking too long to discharge a patient? What does that look like? We are able to drill down into the details of all of the data and be able to understand where the hotspots are. And so that's another example of Sutter Navigator is actually helping drive a lot more efficiency, a lot more productivity in our ecosystem, and then providing visibility to where it matters the most.
So Sutter Navigator is has AI engine inside it. Like, how are you? If I was going to start, let's say I had a 3 or 4 hospital system, smaller than you guys, but let's say and I wanted to come up with a similar platform. Are we talking about combining everything that I have in sort of the biggest disparate data platforms I have? Probably my EMR. Let's pretend we're on Epic. Probably have some other operational platforms that I'm unaware of, not being a hospital administrator myself, and then bringing in a certain AI engine that is self-engineered, or bringing off the shelf and incorporating it. Tell me a little bit the ingredients here.
Yeah, it's built in layers. It starts with good data, Eric, like you said. It's really integrating a lot of different types of data together, so you get a common view of the information. So that is not new. It's been done for a long time. It's classic analytics and data warehousing, if you will. But once the data is there and we know it's clean and it's quality and it's fed on a frequent basis, the opportunity we have is then to show different views and visualizations of that data to the right personas, depending on whether you're a nurse or a physician or a financial analyst. Depending on who you are, you can actually see different views. Once you start seeing those views, you can then say, where are my trends going? And that's where the AI part comes in, the prediction and the monitoring and prediction comes in, because you can start to then say, well, am I on target to meet my plan for the year or for the month or not? And asking those questions then can lead you to the right action plans as well. So we built all those capabilities in the tool. We custom built it. We leveraged some of the technology we already had in-house. And then we rolled it out in a way that made it simple and accessible to everyone.
Love that. So, and I just want to be clear. So you mentioned, the good data and the data warehousing with a common view. I'm going to skip number 2 and go to number 3. You're using AI to see the trends and where we're going and monitoring that, and maybe even finding the right action plans. The second thing you mentioned was showing different views and personalizations to the right persona. So the head of the chief nursing officer isn't necessarily looking at the same data that wouldn't necessarily be relevant to him or her than maybe your chief operations officer, your CFO. Is that AI driven as well? That seems pretty sophisticated, or is that not?
There are parts of AI within it. And Eric, one clarification too is we believe in data democratization. Data democracy to me is make all the data available, of course, within the right, security constraints to everyone. And so the views that you see as an operator can also be seen by a financial leader. And that's the beauty of this, is because we all are operating on the same platform of information from which we can make great decisions. And I think that's really key to adoption as well.
So you could customize your view. I may want to see one view, but if I want to see your view, I could I could pull it down too.
You can do that. You can export it. You can share it in presentations, and we've tried to make it as easy as possible to cater to different needs of audiences. For example, some people are familiar with Excel, some like PowerPoints, some like to ask questions like generative AI type questions. So we sort of encapsulated all of the different ways in which people can interact with the tool and build those capabilities at the right point as well. So there is AI built in it, in the sense that we can use AI to ask questions and get answers. This sort of is built upon a common ecosystem and a platform that allows us to visualize, distribute, and ask questions of.
Love that. Visualize, distribute, and ask questions.
Ask questions about, yeah.
So before I want to cover ROI later on, so I don't want to go deep into this, but it strikes me, I want to ask this before I forget. So a lot of ROI is, CFO friendly, right? It shows up in dollars, but not all of it.
Yeah.
There's some intangibles, right?
Yeah.
So realizing that not all of it shows up in dollars, and let's keep this answer specific to that, because I'm going to get into dollars and cents later on. Can you give us an example of a use case at Sutter where AI created value beyond the dollar that wasn't easily captured by financial metrics, but you knew, wow, this was probably worth it?
Absolutely. And you talked about CFO, and we have an amazing CFO in our organization, Jonathan Ma. And I love one of the quotes he says, which is, if you really focus on taking care of the patients, the financials will take care of themselves. And if you do the right things, if you do the right, take the right steps along the way to ensure the best, care of our patients, everything else is, follows along the way. So we think about qualitative and quantitative ways of measuring return on investment. And I'll go back to the story that I mentioned about the ambient documentation, right? When we rolled this out, we weren't about necessarily measuring, how many hours a day somebody is saving. We were more about, is this the right thing to do for our physicians? One of the things is physician recruiting is, there are not many physicians out there. And we want to make sure that our physicians feel supported and they have the right tools and the right technologies in place to practice medicine. And to do that, we want to make sure they're happy, they're not burnt out. And implementing technologies like these, we knew was the right thing to do, because ultimately it translates into great care for our patients. So we started with that premise that we really want to make it easy for our physicians to practice. Along the way, we found great opportunities then to start measuring a few things, and we'll get into the specific measurements later. But that's one example where we truly saw, doing the right thing actually matters and helping the mission of the organization.
Okay, so ambient listening wasn't chosen because it may save you guys money, but it was like doing the right thing to support providers, enabling them to more easily practice medicine. Makes perfect sense. But there has to be, are there performance metrics specifically that allowed you to have confidence that this was the right program at the right time? Like, what gives the organization? I mean, ultimately, I'm just talking to, maybe I want to make sure we give confidence to individuals who may represent organizations that are less maybe financially secure than Sutter.
Sure. Yeah.
And I don't want to get into the money yet. I know I know we're on the edge here, but like, what are some of the performance metrics that gave you confidence that this was the right thing to do, or is it just like, we just know this is the right thing to do?
There were a few metrics for sure, right? Because we're a very data-driven organization as well. We want to make sure we have an ability to capture many different things. So, one approach we think about is, I call these input metrics and output metrics. So input metrics are the metrics that you sort of do the basic measurement on, how many visits actually happened, or how many conversations did the physicians have, how many clinical notes were written. So very basic things that you can measure through a system, right? And that's important because we want to understand, what's the adoption rate like. And we have charts and dashboards that show us, the gradual, adoption and opportunities where we need to go deep or go faster on. So we have that. those translate into output metrics, which are really about patient satisfaction or physician, burnout reduction or client satisfaction surveys. So we then take these groups of folks that are implementing AI and really ask the question about their satisfaction. Are they truly moving the needle? And we collect both qualitative and quantitative information there. And that leads to ROI, because the ability to understand a positive sentiment of a physician group, right? And there are intangible benefits too. A physician group will be vocal about the use of their technology. They have many forums in which they discuss and say, hey, I'm using this tool. This is really cool. You should use it too. And that sort of word of mouth and that sort of collaboration amongst the physicians actually helps drive change as well, which goes back to one of the key factors of success of AI in any ecosystem, is that you got to have co-creation with the clinicians and the physicians. You got to be there where they are. You got to help them at the point of care. And so,
yes, I was just saying, if you're watching on video, I'm smiling because that's my next question. It's like almost like you know where I'm going. So, can we talk a little bit about that trust that you just brought up?
Yes.
What have you learned from earning trust when introducing AI into their workflows? Like, to tell us a little bit about your journey there and what you've learned, the good things and the bad, and just because I'm sure everyone's thinking of that same thing and has their own culture with provider adoption in their organizations.
I go back to what I said at the beginning, like the patient-physician relationship is so sacred and so powerful that there's an element of trust within that is built already, AI or no AI. There's already trust there. The key is to respect that trust and to build upon it. And we have a great group of physicians that are excited about the use of technology and AI in the mix. And a lot of times they are not sure. It may be very easy to believe all the shiny object, narrative that is out there saying AI is going to save you this much time or effort and so on. So trust comes from really experiencing it, using it, getting the right results. And we spent a lot of time actually tuning the AI so that the results don't hallucinate. They represent the best sort of mix of our data and our patients. The training models are not biased, towards one demographic. All of these things build trust, and all of these things help physicians start to really advocate for it. And then the cherry is really when the AI works as expected, and they're actually focusing on patient care. So our learning has been about being very clear about getting feedback at the scaling process. So we started with 100 physicians. We slowly grew that, and then rapidly grew that because we are starting to see the snowball effect of people really wanting to use this technology. And when we saw that actually happen, we also went back and asked, what can we do better? What are some of the inputs that we can actually incorporate into the design process? And we have some great partners that helped us really put this together and ultimately make it seamless from a physician standpoint. So all of these aspects are important in building trust and growing. The last point I'll quickly make is the education component. So we have a whole training academy or a learning academy actually that we activated as we rolled these things out, because it's important to sort of communicate with very in the context of the physician, in their hospital, in their ecosystem, for their workflow, so that they actually can learn. It's not some abstract thing. They're actually learning how it actually impacts their own ecosystem. So.
Okay, and you might have potentially answered this question through what you just outlined about respect the trust, build upon the trust between the patient and provider, get feedback during the scaling process, education that's sort of local to the hospital system they're working in and their workflow.